I'm Jim McAleer. I have the privilege of chairing the Orange County Strategic Plan for Aging, as well as serving as the CEO of Alzheimer's Orange County. If we all sound a bit like we're reading from a script today, well, we are. We're working hard to be sure our translators can adequately interpret for us. The OC Strategic Plan for Aging, or OCSPA, was created more than 4 years ago by a visionary group of nonprofits and funders to address the fact that Orange County didn't have a high-level plan to address the needs of our seniors. The report we'll talk about today is the result of that group's great work. The work is supported by the collaboration between OCSPA and the Orange County Aging Services Collaborative, or OCASC. More than 35 member companies come together through OCASC to create and maintain an integrated network of services that address the needs of older adults and their caregivers. Both organizations realize that probably the greatest barrier to planning for the needs of seniors in the county is the lack of coherent, coordinated data. Data between organizations, it isn't coordinated for a variety of reasons, including privacy laws, how different groups count things differently, and track their clients differently, etc. Our report today gives us a picture of what's going on, but we've got work to do. We hope to make this a living and breathing document that grows in time as we create better access to and coordination of data. I'd like to personally thank the Irvine Health Foundation, Ed Kasich, Linda Zimmer, Ellen Young, the team at Shapeable, Dr. Justin Tucker, Jocelyn Rubio, Emily Bennett, and Holly Hagler for their incredible contributions to the report. Particular thanks to our sponsors. These are the folks who helped fund our report: Meals on Wheels, Orange County, Caregiver Resource Center, OC, Dale McIntosh Center, Irvine Health Foundation, AgeWell Senior Services, Alzheimer's Orange County, and the Orange County Community Foundation. Thank you so much to our sponsors. You can see the members of the Orange County Strategic Plan for Aging in our slide here. In deference to time, we won't read them, but please know how much you are appreciated and how much your work has meant to the generation of this report. Now, I'd like to introduce Scott David from Shapeable to discuss the peaks and valleys of that data landscape. Scott?
And thank you all. A number of the other team members will be talking in detail about the data within the different sections of this report. So part of what I'll just talk about briefly is the overall framework of the peaks and valleys of the data and the associated issues. One of the distinguishing features of senior care is the fractured nature of the landscape. It's compounded by the unwillingness of much of the target market to identify with that market or to reveal their actual needs. Aged care is a web of interconnected community and social networks and different levels of scale, from government agencies with state budgets through to locally funded food pantries. So there's a lot of collective wisdom and data to improve the lives of older adults if it can be connected. As Jim mentioned, there's a lot of data that we have pulled together, and this report has over 75 data sets that we have reviewed, 25 industry reports, over 100 academic papers. And we've provided this within a key resources section. And it is indeed living reports to be able to move beyond the areas of digital divide, disabilities, food insecurity, and social isolation. Healthcare and social support for older adults and their families involves products and services which are delivered by many types of organizations. This is the system of care for aging in Orange County, and it includes community-based organizations, religious and civic groups, and of course the wraparound care services, where one kind of service provides additional services on top of the services that they are providing, such as Meals on Wheels helping to provide social isolation support, as an example. So our objective has been to make this landscape more visible and more connected, to map the territory and who's working in the aging sector. What does the system of care look like? Who has data and what kind of data? Out of this, we've created an initial data portrait of Orange County. And we've divided it into a number of different sections, from the ethnicity to housing status to relationship status. This is mapping the territory, as it were, to make it more visible. And this gives us starting points to understand the extent of the needs of the older adults, and it helps us to start answering the questions, such as how many people are at risk of malnutrition, or how many people lack broadband for telehealth, or which communities and ethnicities are more vulnerable to social isolation and loneliness, or how many older adults are also looking after older children with disabilities. There are many open questions that we wish to be able to start understanding in more detail. And behind this data portrait, there is also lived experience and behaviors, such as fears around autonomy, and also the link between food quality and pleasurable nutrition. There are deep social and quality of life benefits which don't get fully captured yet in data. The system of care is also a hierarchy of positive relationships, and also of the mentioned wraparound care services. As I mentioned, Meals on Wheels helps to also provide social isolation relief by appearing and participating with the local community. So we've gathered evidence and we've mapped through collaborative review and focus groups a whole range of information. And we've also looked at the connected issues relating to these different areas across digital divide, across disabilities, across food insecurity, and across social isolation and loneliness. And other members of the team will go through these details shortly. And underlying each of these themes, there are common other themes, which are like affordability, mobility and frailty, nature of community, awareness and communication, autonomy, and of course, personal preferences and behaviors. But also one of the most important revelations is that strengthening the system of care needs a high degree of collaboration between the organizations. By joining together to share information, connections, resources, best practices, we can help to improve the lives of older adults. So we've put together 6 recommendations in need of collaborative groups to come together. And we've also mapped, with these here are around common standards for statistics, community directories of data, system-wide understanding of needs, these kinds of issues. And these are all in detail in the report. We've also looked at the activities of the Californian master plan for aging and looked at each of these and mapped them in relation to the activities that are going on against our key areas. And beyond all of that, we have the mentioned 75 plus data sets, 25 plus industry reports, and 100 plus academic papers. These are available in the report. It's possible to search by them by different type. So you can see all of the aggregated data reports, for instance, that we have worked on that are part of this overall report. And beyond that, we also wish to have collaboration around the different content that we have. So we also have a feedback form available if anybody wishes to tell us about more data, the availability of data that we haven't yet discovered, or offers to collaborate and assist. So in essence, we have this framework in place of our system of care, its web of data and organizations, and it is ready for further collaboration. Thank you. Back to you, Jim.
Now, allow me to introduce Dr. Justin Tucker as he discusses that very same data, but specific to our area. Justin.
Thank you. I'm glad to be with you, and I'm glad that you have an interest in understanding how to better serve the older adults in Orange County, particularly as it comes to data. Orange County has a very highly fractured system of care for older adults, in that a lot of different organizations all serve older adults in different ways, and they often don't communicate with each other. So there is a tremendous amount of data available, but there are significant problems with obtaining it and using it. So that's to say, each organization gathers data for its own use, and that's great, but it costs them something, either time or money, and they may have privacy or other restrictions on sharing that data. There are valid legal concerns and really significant organizational boundaries that have to be navigated for organizations to share data. And particularly with nonprofit organizations, sharing their data may put them at a disadvantage for other funding opportunities with other community organizations who might serve the same purposes. Each organization collects and measures their data in their own way. And that makes it useful for a single purpose, but it makes it difficult to use for interpreting about bigger, broader trends in Orange County. So we have to stretch to interpret it for what it means for other purposes. For example, one organization may be tracking the number of people who live alone in a certain area, but that living alone only is reflective of a bigger, broader problem of social isolation. And that organization may only exist in part of Orange County and not serve the rest of the Orange County older adults. Additionally, there is data available that organizations have that they may not know could be useful to bigger, broader causes, or data could be aggregated in new and different ways. For example, community centers are run by cities, and they report to cities, and they track how many participants there are in classes. They'll track how many classes are offered of certain types, and then they report back to the cities. But it requires coordination between the cities and other organizations to determine how many older adults are being served at these senior centers. And it's very difficult to know how many of those senior centers offer technology classes, how many older adults attend those classes, whether or not those adults are repeat users of those services, or sometimes if those adults transfer from different areas to different areas. An additional example is something like 211 that will collect data about its users and a very small proportion of them will be for older adults. So we have glimpses of what's going on inside Orange County using 211 data, but they don't consider reporting out on older adults necessarily to older organizations because it might not be as useful. The holy grail for understanding older adults is to understand unduplicated service provision. That's to say, being able to track an individual through the system of care to determine whether or not they're receiving services at one organization and another organization and another organization, or whether or not they're receiving no services. And right now, all we get to report are aggregate numbers. So we don't know if an individual is, for example, eating at a senior center in a congregate meal program, attending classes at that same senior center, and then going to a food pantry that's either distributed at that senior center or through another one of the pantry affiliates in the county. Is that one individual or three separate individuals? And right now, the way that we collect the data, it is impossible, extremely difficult, if not impossible, to determine whether or not they're three people or one people. So if we want to understand the bigger, broader landscape in Orange County, there's some data needs that we need to overcome. And until we can get to that point where we determine unduplicated service provision, we have to take data from organizations that serve everybody in the community, or at least organizations that gather data in the same way so that they're comparable. So we started with the American Community Survey data, which is from the US Census, and it reports throughout the entire United States. But we gathered that data, and we'll show you later, can display that at the census block group level. We also gather data from Orange County specific organizations like the Orange County Office of Aging, some from 211. And then we have various project partners who collect data in the same way because they report it back to, say, the Orange County specific organizations, or they report it back to their grant funding organizations in the same way. And we can aggregate those numbers because the data are collected in the same way. So oftentimes funding requirements determine whether or not data will be comparable or if they'll be gatherable. Some, unfortunately, organizations gather great data, but the data are not comparable, like a single organization's survey or a policy analysis. We still use those to gather insights to what's going on in the county in a specific area so that we can determine how to gather that data for larger aggregate surveys. We also sought out different ways inside Orange County to gather the needs and experiences of older adults using qualitative data like panel interviews and some other qualitative methods. So the data you see in the report are hopefully a start to a larger opportunity to bring together our data so we can paint a better picture of the issues that older adults face. And bringing this information together into one place will greatly increase our understanding of these issues, the provision and duplication of services, and allow for better targeting of our efforts to reach the greatest in need. I'll turn the time back over to Jim.
Thank you very much, Justin. You know, we're trying to lay the groundwork that shows how difficult data analysis, particularly in our area, can be. That said, I think we've done some good work on getting ourselves to a place where we can see some numbers. So as you can see from the screen, when we were deciding which areas to focus our report on, the digital divide seemed an obvious choice. We're all using more and more technology, and with COVID, that trend increases. If you look at the chart, an AARP study in 2021, 2,250 folks over 50 showed spending on tech increased 194% from 2019 to 2020. Smartphones, tablets, wearables like Apple Watches, like wandering devices, smart home tech like Alexa, all bought by the ton. For folks over 70, 53% own a tablet. 20% have wearables. 27% have a home assistant, a technological home assistant. We go down a little bit lower. At first, it seems that the OC does very well. 95.3% of households have a computer, 95.3%. 90.7% have broadband. The OC has only 6% of seniors without some form of internet. 13.1% don't have computers, accessing the internet on their phones or other device. We're still ahead of California and the country for these measures. The county had an amazing program last year, giving $2.4 million to provide iPads, training, and internet to residents over 60. But folks, that doesn't mean we don't have work to do. 54% of seniors want more education on how to use their technology. The seniors most affected by the barriers of finances, training, equipment, well, they tend to be those among us experiencing financial difficulties, access issues due to age-related disabilities or disabilities in general, those with language barriers. Short, the ones who are most often disenfranchised are those most likely to have greater barriers to technology access. We might take a page from the California Master Plan for Aging's playbook. Take a look at the slides here. They note how, among other things, that we need to enhance telehealth access, distribute technology, and provide more broadband access. I love this one personally. Use technology to create alternatives to nursing home stays. Now let's move on to, Now let's move on to food insecurity and Holly Hagler, President and CEO of Meals on Wheels Orange County. Holly, thank you for the tremendous work you've done on this report. You've been amazing.
Thank you, Jim. I appreciate that. And I actually am going to start with social isolation because it is one of the factors that impacts food insecurity. And then a little later, we'll come back to food insecurity. So I'm going to share my screen right now. And I just want to make sure if you cannot see my screen, perhaps somebody can let me know. When we think about social isolation, it's a physical state defined as prolonged lack of contact or communication with others. Loneliness is the emotional, psychological, and physical experience of persistent social isolation. Although one can lead to the other, they are not synonymous, as it really is spelled out here. Importantly, it is possible to be isolated without feeling lonely, or to feel lonely without feeling isolated. And I'll just comment that Lisa Marsh Ryerson, who was the president of AARP Foundation in 2018, has said a county's social isolation risk score is a composite measure of 6 risk factors. These include whether residents live in poverty, live alone, are divorced, separated, or widowed, never married, have a disability, or have difficulty with independent living. And as you can see from this graph, there are additional interrelated factors that influence a person's risk of social isolation. It can be their community connections. And remember, isolation is not coming in contact with other people who might be able to provide support. Dementia can be an issue, financial resilience. As Jim was just mentioning, technology access and capability, personal mobility has a big factor. And so these are very important factors. And as we can see in this section of the report, older people who are socially isolated are more likely to have less healthy behaviors, like poor diets, tobacco use, and lack of physical activity. Socially isolated individuals have an increased risk of developing depression, anxiety, and dementia. And sadly, they are more vulnerable to abuse, both financial and physical. And then I would just comment that the medical effects of loneliness show that living alone, loneliness, poor social connections are as helping 15 cigarettes a day. It is worse for you than obesity, and it is likely to increase your risk of death by 29%. The range of adults as age 65 plus who are at risk of social isolation is between an estimated 95 and a little over 100,000 individuals in Orange County. That's a lot of people. And in 2019, there were 93,000 older adults in Orange County who lived alone. That doesn't necessarily mean that they were lonely or isolated, but it does increase their risk. And 24% of Orange County adults over age 65 have difficulty speaking English, which can also cause a predisposition for isolation. Further, caregivers are more inclined to loneliness, 42% more than other midlife or older adults who experience it at a rate of 34%. A University of Michigan and AARP study on isolation during COVID found that feelings of isolation increased significantly between 2018 and 2020. No surprise, right? Isolation was felt more significantly among females, lower income, those who lived alone, were unemployed or disabled, caregivers, and those lower in mental or physical health. These are all really critical issues. Further, the AARP Foundation and the NORC at University of Chicago have produced an interactive map called Connect to Effect that helps communities understand social isolation in their communities. And I just clicked on the link is something that I think you might want to come back to if you're interested in this topic, to really understand that and how it the implications for Orange County. Further, I'd just like to point out that there are a lot of interventions also in our community, and there's a large discussion of that in the report that I hope you will explore. And the Orange County Strategic Plan for Aging has helped a number of community organizations collaborate to provide the OC Heart to Heart Visitation Council and an annual conference. And participating organizations include many of those who are on the call today and who are very active in trying to connect older adults and with people that can help them address social isolation. So that is that concludes that part of the report.
Thank you, Holly. Well said. As a reminder, if you have questions, please enter them in the Q&A feature, and we'll get to as many as we can towards the end. And also, as Holly said, the Orange County Strategic Plan for Aging has a number of areas where, outside of a data report, they're actively working to change what's happening in the county. Our food insecurity subgroup, for example, last year reduced food insecurity for 1,100 people. There's some good active work going on. Now let's hear again from Dr. Tucker as he walks us through my absolute favorite feature of these reports, the interactive geomaps. Justin.
Thank you. I think you can see my screen now. When you land on the landing page for the report on Orange County, if you click to the introduction, right here at the very beginning, we've mapped as much of the data as we can. And you can click using the link here or here to this interactive map. It'll take you to the Orange County Data Project, Orange County Strategic Plan for Aging Data Project map. And what you'll see is a very big overview of Orange County. And you can zoom in to an area that you'd like to look at. The county doesn't fit in a very nice rectangular way. So we'll zoom in and you can see part of North and South County. Along the left-hand side, we have a bunch of layers. And just like we used to use transparencies on an overhead machine, each of these layers stacks on top of each other. The default is to look at where people live, the percentage of each census block group that has a population over 65. You can toggle on the left-hand side over here to see the legend. That'll collapse and expand. But the percentage of 65 older adults in the darker areas are higher than in the light areas. You can zoom into an area and click on it. We'll just look at this area in Newport Beach, and a pop-up table will give you the percentage breakdown of those age 60 plus, 65, 75, 80, 85 plus. And it's written out in 0.65. So 63.8% of the population in this little census block group is over 60. We can scroll all the way down to over 85. 7% of the population in that census block group is over 85. I'm going to scroll back out a little bit. That pop-up will show up for each neighborhood that you click on for the layers that are highlighted. So I want to show you a couple of these other layers that we have. We can start with the distribution of non-Hispanic, Black, or African-American. You can unclick that. The percent non-Hispanic Asian in the county. Once again, if we click on one of these areas, like say, for example, in Westminster, it'll give you the total population of that census block group and the percent who are of non-Hispanic Asian origin, 82% in this case. We can look at the percent Latino. And if you look over on the left-hand side over here, we have two layers highlighted. Only the top layer will show up. So right now we're looking at the percent Hispanic or Latino in the county. These are not by age. These are just by racial ethnic origin. We can look at, for example, the percent of veterans age 65 and older. And if we click on those layers, we'll go back to this layer in Newport Beach. About 11% of the population is veteran. A very, very small percent of that population is veteran age 55 to 64. About 0.5% are age 65 to 74, and about 9% are veterans age 75 and older. On a more aggregate level, we can stack on top of each other the percent of the population that are age 65, 75 and older, or 85 and older. So looking at from a very aggregate level, obviously this portion of Laguna Woods is a high concentration, but there are pockets throughout the county where we see much larger percentages of older adults. And then, as Holly talked about, we can look at the percentage of individuals living alone in the county. And I'm going to scroll in just very briefly. One of the features of the map is this over here where it says find an address or place. Just below it, it looks like a shower door. If you click on that, you take the top layer, which is percent living alone, and it'll pop up this little swiper bar, and you can see what's below, the layer below and the layer above. So for example, The percentage of living alone in Laguna Woods is also high. And the percentage of older adults is also high. This is a very high risk area for social isolation. But there are other areas right here, for example, near UC Irvine and other places that have a high percentage of people who are living alone, but not a very large proportion of people who are age 65 plus. So we can use some of these tools to understand where the residents are and what their demographic information looks like. We also have others that I'll show you later, but that's the general idea of how we can use those maps to understand the distribution of need in the county. So I'll turn the time back over to Jim.
Thanks again, Dr. Tucker. The maps are truly an awesome tool. Let's turn our attention to the world of living with a disability. You know, as we age, we sometimes acquire age-related disabilities. And of course, those who have disabilities are also aging, as are we all, which compounds the numbers dealing with those kinds of issues. Share my screen real quick. If you look nationwide, people 65 and older, 7.2 million people have hearing loss. 10.8 million have ambulatory difficulties. 4 million with self-care difficulties. These numbers are huge. They come from the census. So to drill down into Orange County, we had to do some extrapolation from that data. But here's what we found. 148,233 seniors. Seniors in the OC have some disability. Folks, that's 30.4%. A household with an adult with a disability that limits their ability to work requires, on average, 28% more income to have the same standard of living as the same household without a member with a disability. It just costs a lot more, 28%. Because of the additional living cost associated with disability, working age adults with disabilities are twice as likely to have incomes under the poverty threshold. They're more likely to be unemployed. Those who are employed have lower wages. According to the National Disability Institute in America, 26% of individuals with a disability are living below the poverty line compared with 11% of individuals without a disability. Again, 26% of people with disability live below the poverty line compared with 11% of individuals without a disability. I doubt most of us think that that's okay. Our caregivers are also aging. 53 million Americans provide caregiving support to an older adult or child with special needs. That's an increase from 43.5 million in 2015. That's a 10 million increase since 2015. 34% of caregivers are 65 or older. Of these caregivers, 1/3 report to being in fair to poor health. So again, of those caregivers, 65 and older, 1/3 report being in fair to poor health. The number of hours dedicated to caregiving increases with age. Increases with the age of the caregiver. Older caregivers, 65 plus, giving more than 30 hours a week in family caregiving. So the older these folks are as caregivers, the more hours they tend to give to caregiving. The Dale McIntosh Center, a terrific OC organization focused on disability supports for all ages, indicated that their biggest unmet needs are housing and in-home care. Caregiving is really needed, but really expensive. They shared stories of people having food, but they can't cut it or prepare it for cooking. It seems we do indeed have a lot of work to do, and particularly in the disability community. Now let's go back to Holly, and this time I believe the topic is indeed food insecurity.
It is. So, yes, I'm going to go ahead and share my screen. So, I'm really excited about this this section because food insecurity has been such an important topic recently, especially for older adults during the pandemic. And in the report, we describe food insecurity at the outset. USDA defines it as a lack of access to enough food for an active, healthy life. And it can be defined simply as an economic and social condition of limited or uncertain access to adequate food in socially acceptable ways. That's clearly an important distinction there. Now, the California Health Interview Survey, which I have clicked on unintentionally, and I'm going to click back, but a lot of the data in here can also be found. A resource is Orange County's Healthier Together website. And you'll be able to click on that and see the data. So let's just look at this data. Currently, for older adults who are low-income older adults, which means they're living at 200% or of the federal poverty level or below, that figure is 29%. So nearly 1/3 of older adults are living below are experiencing food insecurity if they are low income. This is especially true of Black households, and it is who experience 2 and 3 times the nutrition insecurity compared to 7.1% of white households. That's both the same for Black and Hispanic households. Further, the data does not address individuals who live at greater than 200% of the federal poverty level and who may be experiencing food insecurity due to lack of income, mobility, isolation, the digital divide, health and cognitive impairments, some of the very things we've already talked about today. And one of the things I really appreciate about this report is the effort that Dr. Tucker made to try to estimate the actual number of, rather than just the percentage of older adults who are food insecure. And it's a bit of a different exercise. And after much analysis, we determined that in Orange County, there are between 113,000 and 200,000 older adults who may not be getting enough to eat due to economic reasons. Clearly, that is a large range. So first of all, 113,000 is an extremely large number. 200,000 is nearly double that. And this could be influenced by the factors just mentioned: isolation, access to information, health, and mobility. The report also notes that food insecurity rates in the US are highest in the 60 to 69 age group and lowest among the 80 plus age group. And that could be because they are in care settings or being taken care of by caregivers, as Jim was just talking about, the impact on caregivers. Further, the CDC has observed that the greatest risk from food insecurity is malnutrition, which is an easily modifiable health risk, which, if left unattended, leads to chronic disease. And older adults who are experiencing food insecurity are 60% more likely to suffer congestive heart failure, 50% more likely to have diabetes, 14% more likely to be hypertensive, and 3 times as likely to suffer depression. As the report later points out, malnutrition ranges from 12 to as high as 50% among the elderly who are hospitalized, and from 23% to 60%. So we're talking about both food insecurity and malnutrition here. Right. Let me go to the next tab. Furthermore, financial considerations are key factors in food insecurity, which the report explores. For instance, those who fall behind in their mortgage are nearly 8 times more likely to develop food insecurity than those who do not. So that would be a leading indicator. And there is an increasing likelihood of cost-related medication underuse with severity of food insecurity. And what that means is they may not be able to afford their medications and have to trade off between food and medicine. Talking about disabilities, we've talked about that about 30% of OC older adults have a disability, which may be characterized as a restriction on activities of daily living. And what that means is that even if there's food, you may not be able to access the food you have. This quote sort of says it all. There's a lot of food available, but if you have to cut it up and cook it, a lot of these people rely on others to help prepare the food. And in terms of resources for food, there are a number of resources for food in California, in Orange County, in California and Orange County. CalFresh is an extremely important benefit for those who qualify because it provides direct monetary assistance for purchasing food at grocery stores. Enrollment in CalFresh has increased from more than 1,100 older adults in 2006 and 7 to almost 47,000 older adults in this past fiscal year. The details are highlighted in the report, including a discussion on the increased need for meals, even post-pandemic, because the growth of the senior population continues to go up, and the number of people who discovered food providers is increasing.
I'd like to ask Justin to jump in for a quick minute. If you would, just a little bit early. I'll give you a minute to prepare yourself, of course. And let's go back to the data maps. Again, these interactive maps really give us a good picture of very localized data. So while we wait for Holly to reconnect, Justin, perhaps you could orient us to some of the other data maps.
Happy to. So a lot of the issues, like Holly was talking about, are interrelated. Poverty, food insecurity, food provision, disability. There are a number of layers that we added as well to the map. For example, we've talked about living in poverty already. We can look at the percentage of families receiving supplemental benefits. So that would be CalFresh, SNAP. Once again, we can click into these spaces. And this is a great spot to say, if you see that the information that you want is not displaying, if you click over here on this little triangle, it'll show you the other information about that layer that's available. So in this one block over here, it's about 12.5% of families receive supplemental nutrition support. And that'll tell you exactly how many families in each area. One of the great things that we did was we pulled as much information as we could from partner organizations to move away from the American Community Survey data and look at really generated data that's generated specifically in Orange County. So one of the things that we were able to do was partner with Orange County Department of Aging and Meals on Wheels and others to look at where home delivered meals are being delivered in the county. And once again, we can click over here to the right or on the left and see how many clients in each of these census block groups are receiving home delivered meals. So we can click here. I'm going to deselect. That's another thing. We can deselect some of the layers and figure out. In that area, there were 10. There were 10 who received home delivered meals. In this layer, we added all of the individuals who were participating in congregate meal programs. Once again, the darker shades are more individuals participating in congregate meal programs. And one of the insights we glean from the data is when we map where the senior centers are, you'll see them show up as dots, black dots. One of the pieces of information we gleaned was that where the senior centers are located have higher proportions or higher counts of population of older adults who participate in congregate meals in the county. So almost everywhere where you see a higher proportion or a higher count number of congregate meals, this is where older adults come and sit and eat. They benefit from the nutritional side of things, but also the social isolation is overcome because they're in a group setting. They're largely located where senior centers are. We also know that older adults receive food from a variety of other places, including, I'm going to click back over here. They get food from food pantries. And so thanks to Second Harvest and Orange County Food Bank, we are able to map where every one of the food pantries is in Orange County to look for food distribution patterns. And so we can look for those things as well. And if you wanted to see where those are located, or the blue dots are affiliated with Orange County Food Bank and the green dots are affiliated with Second Harvest. And it'll tell you the name of the pantry and what the affiliation is if you wanted to click on each of those. So some of the other things that we've mapped are there are older adult outreach programs through Second Harvest, and we've mapped where those are within the county. We've also mapped where adult residential facilities are. So if they're looking for housing, to see if there are patterns in where older adult housing is, adult residential facilities. Affordable housing throughout the county are in purple. These are from a county list of low income or affordable housing. But then additionally, we have another layer of affordable housing that is just senior apartments. Now we could, once again, take that information and look for the percentage of people who are 65 plus. And it doesn't look like there are any real patterns or groups. So it looks like maybe these housing units are not as populated with older adults as they need to be. So there are 150 total units in Remington of affordable housing, and there are 0 available units for affordable housing. We could look down here at Heritage Park. There are 10 affordable housing units out of 180. Those are all for the senior apartments. So we can take some of this data and overlay it so that we can get a better picture of what's going on with older adults in the county. And part of this is to have you explore, to look for trends, to see what you see in the county. So as we have more data that are available, that can be shared, that can be compared, we can map that information and look for specific neighborhood trends. We can share that with our project partners. We can look for variety of opportunities to collaborate, but we can also look for areas that may not have data, where we want to gather data and where we can look for need that doesn't currently exist. So I'm going to turn the time back over to Jim.
Thanks for jumping in, Dr. Tucker. We're going to bring Holly back. I believe she's crossed her own digital divide today to join us again. Holly.
I have. All of a sudden my screen went blank. So I just wanted to share two more comments really. And that is And Dr. Tucker was just commenting on the congregate sites, which are really meal sites at senior centers that normally, when it is not COVID, serve hot meals in a group setting, a congregate type setting, very social, which addresses the social isolation, as well as provides nutritious meals. When COVID hit and everyone was sent home, the meal providers, AgeWell Senior Services, the City of Irvine, and Meals on Wheels OC worked with the county, and we converted those to large scale, really, food distributions of frozen meals. And that drove and enabled a lot of this really huge increase in meals that you see. The largest came from these grab and go locations, which are still active in the areas of the county that continue to have the greatest need. And those and many people who came to those sites had never been aware of these programs before. And as I was saying, these needs are going to continue now that they have found these resources. They really need them. One other point is I wanted to mention, as Dr. Tucker was talking about, the food banks. Second Harvest operates the Senior Grocery and Market Market, and the Senior Grocery Program is held at 41 sites, many of them senior centers, to distribute meals. And the Parket Market is a mobile food pantry that visits different locations to serve older adults. And the Orange County Food Bank, which is run by Community Action Partnership, distributes senior food boxes at a number of locations. And these are really critical parts of the system of nutrition for and support for older adults. So that really concludes the part that I wanted to share.
Holly, thank you so much. One of the things that today very clearly shows us is we are not operating in silos, even if our information is siloed. Rarely does a senior only experience food insecurity. Perhaps social isolation, perhaps a lack of accessibility to assistive devices. And we haven't even touched yet on transportation, housing, elder abuse, and a host of other topics. What we have done is we've opened a conversation about seniors, Orange County, and what's really happening with those folks with quantifiable, verifiable data. It's incredibly important. And we very much hope to continue that conversation, to deepen it. If you have data sources you don't see reviewed in the back of the report, if you know of information not included in the report you think should be, it's a living and breathing document. At the back of our website, which I'm going to get, hang on one second. At the back of our website, you will find a form to be able to give your name, information, and any suggestions. It's at data.ocagingplan.org. Again, data.ocagingplan.org. Jocelyn will drop it in the chat just to make sure that you have it. We're very open to feedback and to suggestions as we move forward, because we do intend to move forward. Now I'm going to look at the question and answers. We were able to answer some, so you might look at those that were already answered in case they might also be something that you had interest in. If you have questions, please drop them in the chat. We have a few moments with our panelists still with us. While you drop those in, I want to thank in particular our interpreters for making this an accessible vehicle. We've certainly done our best, but they're the ones who make it happen. Looking for questions. And I see Dr. Tucker is really fast to answer these, but I would encourage you to look at them so you can see his and my answers so far. So I have one question before we wrap. Holly, with all of your information and knowledge about food insecurity, with everything that happened with COVID, the Great Plates program, the new resources that flew in and then seem to be flowing out, as we leave the COVID era, one hopes, or at least partially leaves it, where do you see the long-term impact on Orange County food delivery programs, food as it relates to the COVID impact?
Many people found us during COVID, whether I say us, it could have been the food banks, it could have been pantries, it could have been any of the Meals on Wheels providers across the county. And they are not, many of them are not going away. They needed us before COVID, and they just weren't aware of this wonderful resource. And now that they have it, they need to continue to be served. And so that is a key concern. We're talking with the county and with funders about that. I would also say that the impact of inflation right now is like a double pandemic. And so we all know that, we see that in all of us that are participating today. The services we provide are needed now, probably more than ever. And it's hard to see a time when that's going down. Also, I would just comment, there is a discussion in the report, in the I think it's in the food insecurity section, about what happened after the Great Recession. And that in that case, it took 10 years before there was a trend downward. And what we have going on now is this high growth in the senior population. So it's not going to trend down, regardless of what happens with the economy, and it's going to continue to rise.
We're also seeing in Orange County a decline in every other age group. So when you think about the fact that you drive down the street and you see all of these wanted signs, help wanted signs, the senior industry is no different. So folks aren't even able to get help, even if the resources are there. So that's something we're definitely going to have to get our hands around, and soon, as our population ages and those existing to care for them decline in the county. It's an expensive place to live. I see that Dr. Tucker is answering one question. Time for one more, perhaps. And not seeing any. I want to again thank our panelists, our Sheridan, our folks at Shapeable, just everybody who's been involved with this. And I won't go through the names again, but I particularly want to thank those who put so much time and effort into making this report, our translators. And if you want to get involved, fill out that form and we'll find a way to make that happen. This needs to continue. It needs to get better. We need to have deeper, better, more correlated data. One last point, the County of Orange has begun to start talking about helping to create something, potentially a county master plan. So I celebrate that and I congratulate the county on even thinking about making that happen and encourage them to do so. While the county is not the only entity that needs to take care of all these things, they are the biggest game in town. So it's great that they are considering that and that they participated so fully and well with the work we do. Without seeing any other questions, I thank you very much for your time. Thank you, Jocelyn. Thank you, Melissa, for coordinating today, and we will wish you well.